Spring has sprung, and besides flowers and warm weather, that means allergies. Here to tell us a little bit about what is called sinusitis and other allergies is Dr. Michael Lupa from MidState Medical Center. Doctor, thank you so much for being here.
Thanks for having me.
Let's start off exactly, what is sinusitis?
Well, sinusitis is basically just inflammation of the sinuses, and a lot of people don't know the sinuses are just empty spaces in the bones of your face.
Okay.
And when that inflammation happens, you can get a lot of symptoms.
Very uncomfortable symptoms at that.
Yeah, they can really affect your quality of life.
And it seems as if this time of year is particularly bad. Why would you say that?
Well, as people get allergies, there's inflammation, and the sinuses, which those are the empty spaces, they can't drain as well, and often you'll get an infection. But allergies and sinusitis are different things.
Okay. And then I guess compare it to the allergies, if you would, for me.
Sure. So allergies are the body overreacting to things in the environment that are completely innocuous. So in the spring, it's usually pollen, and typically it's pollen from trees. But people can have allergies all year round to things like dust mites, their pets, and molds.
All right, so we'll go back to the sinusitis. Talk to me about how you can fix that. What are the options for people?
With sinusitis?
Yes.
Typically, the mainstay of therapy is medical. So I would start, if you had a sinus infection, I would start with antibiotics, steroids, sometimes inhaled steroids, and actually nasal saline, just to wash things out.
That's pretty simple, right over the counter then, right? A good place to start?
I'm a big fan of nasal saline. You really can't hurt yourself with it, and it's a great medicine.
It's a little uncomfortable.
It depends. It's more comfortable being able to breathe through your nose with the saline than not being able to breathe.
Good point, doctor. All right, so we were talking about pollen, moving on to allergies now.
Sure.
Again, over-the-counter medications, you would say?
Yeah, so I mean, there's a number of different options over the counter now. A lot of the things that used to be prescriptions, such as Allegra and Zyrtec, they're out. They're over the counter. There's generic forms. They're great medications. They don't cause as much sedation as some of the older medications like Benadryl.
Sure. Well, then how would you know what's right for you? A little trial and error, or?
I mean, these medications are very safe. It's very difficult to hurt yourself with them. So I think trial and error. I would start with, again, I love saline, and then a little antihistamine such as a Zyrtec or Allegra. Sure.
Now, would you say there are ways of avoiding allergies? I mean, you want to go outside and enjoy the nice weather.
I mean, in terms of going outside, you're going to expose yourself to the pollen. Choose a day that's got a lower pollen count. If it just rained, actually the pollen counts are typically lower, so that's a good time to go outside.
Okay.
You know, if medication, obviously you're going to take your over-the-counter medication, and if it's really bad, you know, you need to go see a doctor and get a stronger medication to be able to.
And that would be several weeks without any sort of relief. That's when you would call the doctor, would you say, or?
I mean, it's a quality of life. If the pill is not working for you and you can't go outside because your eyes are watering and your nose is running, I would go see a doctor.
Okay. Doctor, what about any natural remedies you might recommend?
Some would say that there's local honey. It actually has pollen in it, and that can help desensitize your body to overreacting to the natural stimulus.
Great. And allergies really affect people of all ages, correct?
Correct.
You could have young kids, and you might not have it as a child, but it could develop later in life?
That's totally true.
Okay. All right, well, let's put some information up on the screen about MidState Medical Center. In fact, doctor, that is in Meriden, correct?
That's in Meriden.
Give us some more details about the hospital.
The hospital is a nice new facility in Meriden, Connecticut. We've been very proud of our level of care.
Very good. And you can call the number that was just on your screen or go to midstatemedical.org for all the information. Dr. Lupa, I feel like this is a busy time of year for you.
This is a good time for us, yeah.
Thank you so much for all the information.
Thanks for having me.
All right, up next, it's an Iron Chef competition like no other. We'll give you a preview to the Elm City's Challenge of Champions when Style returns. Stick around.